As you start your test, it is important that you appropriately prepare for the procedure. When you enter the room, wash your hands and review the chart. Be sure to look over Martha's history, orders, MAR, and labs. When gathering medications, perform the 6 rites 2 times and ensure that none of the required medications are expired. Use the drug reference if you need to brush up on or review any of her medication information. While gathering her supplies, think through all the future actions and plan accordingly. You may want to bring doubles of certain supplies just in case. Make sure that none of the packages have already been opened or are expired. Remember, you do not want to use contaminated products. Once you feel prepared, feel free to bring all your supplies into the room and introduce yourself to Martha. When you first enter the room, be sure to wash your hands and introduce yourself to your patient. Use nonverbal and warm cues to help make them feel welcome. Identify the patient and check for allergies, especially to adhesives and detergents. Verbalize the appropriate physical assessments and perform those you find pertinent. After you've assessed the PICC line, please then assess the patient's previous knowledge with this procedure, including the medications that you're going to give. You then explain the procedure to the patient, including duration, what you're going to do, and the important factors that they have to play in as well. When your equipment is arranged to your liking and above waist height, it's important to remove any objects from your person that could contaminate your upcoming sterile field. Baggy sleeves, badges, and stethoscopes often fall into your field, and rings and watches can cause accidental contaminations while donning sterile gloves. Also make sure that you are wearing a mask, and if your patient cannot turn their head away for the duration of the procedure, they should wear one also. This is to prevent your up-close breathing from contaminating the site. After removing your gloves and washing your hands, you may create a sterile field using your sterile drape. Follow proper sterile technique while creating your field. Do not reach over your field of supply while opening the package, and only touch the drape within the 1-inch borders of its edges. Keep your drape above waist level at all times, setting it down away from you first while the white side is up. Once your sterile drape is set, open your dressing kit and remove your mask and sterile gloves, setting them to the side. Empty remaining contents of the sterile dressing kit onto your sterile drape, and then drop additional supplies onto the drape, such as a biopatch, a stat lock, sterile 4x4s, and extra Tegaderm. Please be cautious of your 1-inch borders while opening supplies, as if they encroach on the edge, they are no longer sterile. After donning clean gloves, note the centimeters documented on the dressing label. Then remove the dressing. Be sure to be careful and work around the edges so that you do not pull additional traction on the site itself. Inspect the site for redness, tenderness, drainage, and swelling. You also want to count the number of centimeters of the exposed PICC line, confirming that it matches the dressing. Using an alcohol pad, wipe on the securement device, aka the stat lock, to release the adhesive and then carefully remove it. You can use another alcohol pad to remove any remaining adhesive on the skin, and then be sure to double check the number of centimeters on the exposed line. Once your sterile field is created, you will want to don your sterile gloves so you can interact with it. If needed, please make some more space for yourself on your table. However, do not lose sight of the sterile field at any time while moving around supplies. Be sure to follow proper sterile technique when applying your gloves, being mindful of where you touch on the package itself, the gloves, and whether it's the inside or the outside of the glove. Once your sterile gloves are donned, please feel free to interact with your sterile field. Organize the supplies so that you can visualize all of it, and try to remember what steps come in what order to help you make your decisions on where things go. If you touch the PICC line with your sterile gloves, the offending glove would become contaminated. In order to touch the line without breaking sterile technique, place a sterile 4x4 down on the access port to serve as a barrier between the line and your glove. Open up an alcohol swab and lift the PICC line by the sterile 4x4. Wipe around the insertion site and 1 to 2 inches away for at least 30 seconds. Ensure that you wipe off the catheter itself and also go over the skin that the PICC line will eventually rest on. Wipe away from the insertion site at all times and use concentric circles if possible. Allow to air dry. Release the fluid from the ChloroPrep stick and perform a second cleansing of the insertion site and surrounding skin. Remember that friction and drying are critical to the effectiveness of the prep. Do not scrub towards the insertion site. Instead, scrub in horizontal planes around the site and then in concentric circles away from it. Also prep the catheter line itself. And when you're done, allow to dry for 2 to 3 minutes. This is the perfect time to educate your patient on the signs and symptoms of infection and general PICC care and precautions. Place the biopatch over the insertion site with the blue side up. Ensure that the slit in the patch does not line up with the immediate direction of the catheter from the insertion site. This helps ensure that the patch stays in place, which is critical in order to provide a long-term chlorhexidine barrier over the insertion site. Next, apply the SurePrep, also known as a skin protectant wipe or barrier protectant wipe, to the surrounding skin. This is to provide a barrier that protects the skin from adhesive irritation and skin tearing, and this is especially important where you place your stat lock. Do not apply this directly to the insertion site. After carefully coiling the line in a spiral, secure the distal end of the PICC line with your stat lock. Make sure the arrows on the device edges point towards the patient, and lock the line into place. Now apply your Tegaderm in a way that completely covers the dressing site. Use your additional Tegaderm if necessary, and ensure that you have a nice window to view the insertion site for later assessments. Properly seal the Tegaderm down at all sides, making sure there is no raised area on the dressing. Lastly, write the date, your initials, and the exposed length of the catheter on a label. Place that label on the edge of your dressing, being sure not to occlude your window. At this point, you should feel free to remove the masks, your gloves, and wash your hands. Be sure to remind your patient to report any changes or discomfort with their catheter to the RN immediately. After assessing the patient's knowledge of the upcoming medications and educating as needed, wash your hands and perform the third check of the 6 rites. Don clean gloves and disinfect the needleless port with alcohol for 20 to 30 seconds. Do not drop the port while using, and re-scrub if you do to fix your contamination problem. After removing the air from your syringe, attach your first saline flush. Aspirate slowly to check for blood return. Follow policy if unable to get a return. Inject 5 milliliters of saline using the push pause technique, which is done to aggressively push away any contents adhering to the inside of the tube. Disconnect the syringe when done and set aside without contaminating the needleless port. Re-scrub the port and attach your IV medication after removing the air from the syringe. Be sure to administer the medication at an appropriate rate using the push pause technique. Look in the drug reference book if you are unsure of the appropriate rate. Disconnect the syringe and set it aside. Re-scrub the port and attach your second saline flush after removing the air from the syringe. Administer at the same rate that you gave the IV medication using the push pause technique. Remember that pushing it faster than the IV medication's rate would give the remaining medication dwelling in the catheter at an inappropriate rate. Disconnect the syringe and set it aside. Lastly, re-scrub the port and attach your heparin cap after removing the air from the syringe. Once again, use the push pause technique and disconnect the syringe and set it aside when you are done. At this point, you may lower the needleless port and clean up your work area. When you're done cleaning, be sure to thank Martha for her time and ensure that she has no other questions or needs that you can address at the moment. Afterwards, provide comfort and safety, lowering the bed, raising the rails, and making sure the call light is in place. Document your assessments and medications administrations in the MAR, and specific documentation that is required for this test is indicated on your checklist. If you you have any questions or comments about how to perform this skills demonstration test, please come see me in my office or shoot me an email. I'm more than happy to help answer your questions. And in the meantime, enjoy the video, and hopefully you'll get some good practicing in because of it.